Hello everyone, today we are at Bangalore's top rated pain management clinic. So come, let's go meet the doctors and check out what they do at this pain management clinic.
Hello, viewers. I welcome you all to Algos Multispeciality Pain Clinic, wherein we treat all kinds of chronic pain which patients have been suffering. I'm Dr. Khaja Javed Khan. I'm a consultant pain management specialist, anesthesiologist, and I specialize in rheumatology and spine. Here, we treat a lot of patients coming to us with arthritis, back pain problems, shoulder pain, knee pain problems, etc. We specialize in doing treatments non surgically, wherein we identify the exact diagnosis what the patient is having, and we treat them after doing a thorough evaluation and investigations. Our treatments include pain management interventions, like, for example, regenerative treatments like platelet-rich plasma, PRPs, stem cell treatments, etc. We also do a lot of spine-related treatment also, like epidural interventions and fluoroscopy guided, that is X-ray guided, image guided procedures to the spine. We also have in house physiotherapy, wherein a lot of patients undergo physical rehabilitation, assessment, and fitness. We have a nutritionist with us who helps guide patients with proper diet plans, and also a clinical psychologist to treat patients who have been suffering from chronic pain. So, all kind of services related to chronic pain are available under one roof, that is Algos Multispeciality Pain Clinic.
Hi, my name is Sandeep. I work in advertising. I make ad films for a living. I've been having a lot of shoulder pain. It's like a sharp prick on my shoulder. I first sensed it when I was working out. Probably, I think I was doing. I don't remember much, but I think I was doing incline chest because that's when I used to feel most pain on my shoulder. It was a slight prick, and I don't know why it happened. Then every other exercise I started doing above my shoulder, it started hurting a little. The pain kind of intensified after a month or two. It has been there. I was kind of ignoring it, but I think the pain always stayed because sometimes you just kind of ignore it and the pain goes away. But this pain stayed. So I was a little worried about what could have happened because I like to be an athlete. I play football, and I want to be in the best health possible. So I wanted to kind of solve the pain as soon as possible. So I went to a nearby doctor near my house, and then he suggested I do an X-ray, and there was no finding in an X-ray. And then he suggested me to do an MRI, and that's when I found out that there was a partial tear in the muscle. I wasn't very happy with the other suggestions that the other doctor gave. He was like, probably I think you need a surgery and all of that. But I didn't feel that I needed a surgery because the pain was not so intense. I thought that there might be another solution. So I was just talking to my brother one day, and because he went through an ACL surgery, and he told me that, hey, listen, I had actually consulted. There's a good doctor around Indian Express, and he said, why don't you go to him? I said, who's that? Show me. He had doctor's prescription where his photo was also there, and he showed me this, and I was quite surprised because it was the same doctor that I had studied with. We were in the same college, and I was very happy to see that my brother was recommending Dr. Khaja Javed Khan, the Algos Multispeciality Clinic. And I was like, okay. And the funny part is, I've been following him on Instagram since ever since he was there, and I've been following his work about all his. He's been talking a lot about pain management and all of that. He's been educating a lot of people, and I thought he's the best person that I need to speak to. So that's the reason why I've come here. I met doctor, and he kind of examined me, and he said that there is a middle ground that we can settle on. A surgery is not required for a pain like this. So he has suggested that there is a treatment called PRP, where probably I think doctor will explain better as to what he's going to do. He told me that there will be 3 sessions, and I shouldn't be lifting weights till the session is over. Um, and there is a solution. It is going to take some time, but there is definitely a solution, and a surgery is not required, is what doctor has just told me. So I'll be starting with the PRP treatment today, so we'll see how it goes.
Now we shall look at how PRP, that is platelet-rich plasma, is prepared for a patient who has been suffering from shoulder pain. Firstly, we will be doing unpacking of the PRP kit. So we first open the PRP kit and arrange all components under sterile conditions. We use a standardized PRP system which ensures safety, consistency, and reproducible results. The patient's blood is then collected using aseptic precautions. PRP is an autologous therapy, meaning it is the patient's own blood which is used, making it a safe and biocompatible treatment. The collected blood is now transferred into specialized PRP tubes designed for optimal platelet separation. Next, we move on to the centrifugation process. We use a specific centrifugation machine which is ideal for giving best results. The blood-filled tubes are placed into the centrifuge machine. Centrifugation is a process which separates the blood components based on their density. After centrifugation, 3 distinct layers are formed: red blood cells at the bottom, platelet poor plasma at the top, and the platelet rich plasma in between, which is used for the treatment. This process concentrates platelets which release growth factors that play a key role in tendon healing, tissue regeneration, and pain reduction. The platelet rich plasma is carefully collected under sterile conditions, and the PRP is now ready for injection. The patient is now shifted to the operation theatre procedure room. Monitors are attached to the patient to see their vital parameters. Standard aseptic precautions are followed, including cleaning, sterile draping of the shoulder area, wearing sterile protective equipments like OT gown, surgical gloves, etc. Patient comfort and safety are ensured throughout the procedure. We open the sterile kit, which contains the various drapes and equipments to maintain a clean and hygienic environment for the patient. The skin around the shoulder is first painted and cleaned to avoid any infections from the skin. Drapes are placed over the area where the procedure has to be done. Ultrasound guidance is used for this procedure. The ultrasound machine allows real time visualization of the shoulder structures. Here we are trying to identify the supraspinatus tendon and assess the site of tendon repair. Local anesthetic is injected initially and then the procedure is followed. Ultrasound guidance improves accuracy, ensures needle placement, and minimizes complications. Using real time ultrasound guidance, the PRP is slowly injected into the affected region of the supraspinatus tendon. The objective is to deliver the growth factors directly at the site of injury, hence promoting tendon healing and reducing inflammation. The needle can be seen going into the area of the tear, and we are going to inject the PRPs directly at the site of the tear. This targeted approach is one of the key advantages of using image guidance in regenerative pain procedures like platelet-rich plasma. PRP therapy is a minimally invasive regenerative treatment that can be very effective for selected number of patients with tendon and ligament injuries. At Algos, all regenerative procedures are performed with strict protocols, imaging guidance, and individualized treatment planning to achieve optimal outcomes.
Okay, Sandeep, we have completed the PRP procedure now for the shoulder. I hope it was not very painful. Okay, so I'll just tell you what needs to be done. You need to take rest for 2 to 3 days now. Okay, you can apply some ice pack compression to the needle prick so that the inflammation and pain is not much. And I'll just be prescribing a very simple painkiller to help reduce the needle prick pain. You should not do any heavy activities like lifting any heavy objects or doing movements, additional movements from your shoulder joint, because you have to give rest. And once that is done, you can start physiotherapy after 3 to 4 days. Okay.
Thank you so
Thank
much.
you. Thank you. So today we have done a shoulder PRP procedure. In the shoulder joint, whenever there is a muscle tear, what we call as a partial muscle tear, then we do a treatment called shoulder PRP procedure. PRP is platelet-rich plasma. As you have already seen how we drew the blood, centrifuged it, and separate the platelets part from the blood. Now that platelets part we have concentrated, and using an ultrasound image guidance, we injected the PRP into the area where there was the tear in the muscle. How it helps is the PRP goes exactly at the tear portion and it is going to start a healing process. Now, this procedure is better because it is very safe, because the platelets are taken from the patient's own blood. So, there are no much risk of any kind of side effects as well. And once the procedure is done, then the patient will start seeing an improvement in about 2 to 3 weeks' time. As you have seen, the procedure is very simple, minimally invasive procedure wherein just a small needle is taken and giving local anesthesia, the needle is directed into the muscle using ultrasound guidance and the procedure is done.
Hi, this is Sandeep here again. We just finished our third session of PRP. So we did our first session about 2 months ago, and we did the second session after a gap of about 3 to 4 weeks, and this is my final session, third session. When I did the first session, all doctor did was a small prick. That's the local anesthesia, and after that, I didn't really feel much pain. The PRP was injected, and I started feeling a lot of improvement in about a week's time. it slowly, it's a long process, but it the pain was definitely kind of reducing. And by now I think before the third session, 80% I there was a reduction in pain. And my final session just got done, and I'm hoping that probably in another 3-4 weeks the pain would be gone and I'll be back to doing normal activities, and definitely want to go back to the gym and start lifting weights, but a little more cautioned manner. So I think the overall experience here was pretty very very good, I would say. The overall experience was amazing, and Dr. Javed, the professional that he is, he explains what he's doing while he's doing it. He kind of shows you what he's exactly doing, so that you're also not kept in the dark. So that's a very very good thing, that even I know exactly what happened to me, so that I can do my research and find out, what is this entire treatment all about, so that I can tell other people about this whole thing. So the overall experience was great, and I would definitely recommend Dr. Javed and Algos Multispeciality Pain Clinic here. And thank you.
If you or a near and dear ones are suffering from chronic back pain, neck pain, shoulder pain, etc., then at Algos we do have the answers. We do a thorough evaluation, find out the exact cause and reason of your pain, and we treat it accordingly. Do visit us at Algos Multispeciality Pain Clinic.